Good morning, everybody. Thank you so much for your participation today in our workshop on the role of vision in falls. Before I go ahead and introduce our speaker for today, I wanted to go over just some general rules for this session. So please go ahead and stay muted for the duration of this workshop. You'll know that you're muted if you see a red flash through the microphone icon on your screen. All of our workshops will be recorded, and we're going to upload them to our website, www.sandiegofallprevention.org. I'll go ahead and put that link in the chat so you can access those later. If you do not wish to have your video appear in the recording, go ahead and disable your video at this time. To ensure that you have a good view of our speaker today, go ahead and enable speaker view. You can do that by clicking on the top right-hand corner of the screen. And then finally, please type any questions that you might have in our chat box. We will have time at the end of the session to review some of those questions. So our speaker for today is Dr. Beth Sullivan. Dr. Sullivan has been an occupational therapist for over 40 years. Her area of clinical specialization focused on assisting older adults with neurological and low vision conditions. She was an active member of a multidisciplinary fall prevention program and is currently co-chair of the San Diego Fall Prevention Task Force. Additionally, she is a Matter of Balance certified coach. So please join me in welcoming Dr. Beth Sullivan. Take it away, Beth.
All right. Thank you so much, Carolyn. I'm really excited to be part of this presentation today. I think this is a wonderful new event for the San Diego Fall Prevention Task Force. So I'm going to go ahead and share my screen, and I'll try and keep track of the chats as well. All right. So my vision is that you will understand, and we'll talk about the objective shortly, really the role of vision in falls and the fact that there are things we can do to minimize impairment with visual deficits so that it doesn't influence and cause you to fall. So I think the first place that we'll be starting is that you'd understand what the term low vision means, and you'll feel as if you've gained a good understanding of age-related low vision conditions. You'll understand the relationship between vision and falls, and you'll learn some methods to help you prevent a fall due to visual deficits. So my first question is, how many of you know someone who has low vision, or perhaps it's yourself or somebody else? You can unmute or also write it in the chat box. Okay. So maybe I will ask Carolyn to share what's in the chat box.
Yeah, so we have parents, somebody put themselves, mom, a neighbor who has macular degeneration.
Okay. Great. I mean, not great that they have visual deficits, but thank you for sharing. So is low vision prevalent in the United States? And yes, it is, and it's getting more and more prevalent because the aging of our baby boomer population. In 2017, there was a study done, and it said in the United States, for all across the country, there's 1.5 million persons who can't have a visual acuity corrected to better than 20/60. And so when we talk about visual acuity, 20/20 is what you consider to be normal, and that's how far and how an object looks like at a 20-foot distance from you. So someone who has 20/60 vision needs to have that object brought 3 times as close to see it as clearly as somebody who has 20/20 vision. And the a best corrected acuity means that you can, I have 2800 vision, but with my contacts, I have 20/20 vision. So best corrected is with using either without glasses or with glasses or contacts. And 1 million persons across the United States, their best corrected visual acuity is 2200. So that means that that person has to bring something closer, 10 times as close to them as you or I might be able to see at a 20-foot distance. So low vision is definitely increasing across our country, in particular due to the aging of the baby boomer population. So little audience participation here. I'd like everybody to write in the chat box what you think the definition of low vision is. Is low vision mean legal blindness, which is A? B, a visual impairment due to any eye condition? C, only being able to see shadows? Or D, 2100 or less visual acuity in both eyes? So is it A, B, C, or D?
Got a lot of people saying B. B, 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 B. Someone said B. B. Looks like B is the popular response.
Okay, wow. You guys would score 100% on your quiz for the day. So that is correct, because there's a variety of different eye conditions that can cause a visual impairment. I've worked with many older adults who feel or believe that low vision means that they're legally blind. And I'll just pause for a second to define that term of legal blindness. So legal blindness means that somebody's best corrected visual acuity in one eye is 2200. So again, that means they have to bring objects 10 times as close to them to see. But really, legal blindness means that someone can receive some free services due to their visual status. So they might be able to receive audio books, they can get some tax exemptions on their federal and state taxes, they can get free transportation, but it actually, low vision, the term low vision is a much broader concept than just legal blindness. So in terms of low vision, there's a range of visual impairment due to low vision. It can, you've got people who have normal vision, and then you have people who have mild impairment all the way up to severe impairment. And just to give you some more examples with that, so someone with mild impairment, they may be able to do their daily activities with just using extra light or perhaps a small magnifier, as compared to someone who has severe visual impairment where they're only seeing shadows or movement. So the criteria for Medicare in terms of talking about low vision is they define it as persons who have the best visual acuity of 20/70 all the way up to 21,000. So person's functional status at 20/70 is very different than somebody who only has 21,000 visual acuity. And the term blindness refers to that someone doesn't have any light perception or any ability to see movement. Anything more than that is considered low vision. So we'll spend some time now talking about the different age-related low vision conditions, because it's important to understand these so that you understand the relationship of these conditions to fall risk. So the most common one is cataracts, glaucoma, diabetic retinopathy, age-related macular degeneration, dry eyes, and the size of pupils. So we'll go into these now in more detail. All right, audience participation again. So if you can write in the chat box if you think that cataracts are a loss of vision due to problems in the retina, a loss of vision due to problems in the center of the eye, a loss of vision due to problems in the lens of the eye, or a loss of vision due to changes in the pupil. So 1, 2, 3, or 4. Retina, macula, lens, or pupil.
Okay, I'm seeing a lot of 3 answer choices. 1, 2. Looks like we might be all across the board on this one.
Okay, so the reason I think it's important to understand this is that cataracts are the most common age-related visual impairment actually across the world. And it's a term that people use a lot. People are always like, oh yeah, I've got cataracts. Oh, they're not ripe yet. Oh, I have to get them taken out. But the correct answer is actually 3, which is a loss of vision due to age-related changes in the lens of the eye. So, as I mentioned, the causes of cataracts are thought to be excessive exposure to sunlight, the aging of the lens, people who smoke, that they have a greater risk of having cataracts, as well as a diet rich in fats may cause it. Also, persons who have excessive nearsightedness, which means that they can't see a distance, they'll develop earlier cataracts. And 24.41 billion persons in the United States have cataracts. So as you can tell, it's very, very common. Is it going to get more prevalent with the aging of our baby boomer population? Absolutely. So one statistic I found is that 50% of all persons aged 80 and older will have a cataract or will be developing one. So as I mentioned, the aging of our population means that more and more persons will be developing a cataract. So we'll talk now about what it is in a little more detail. So the picture on the right shows an advanced cataract. You see how it's really milky and you can't really see, it's not opaque. And the lens of our eye is similar to the lens of a camera. If any of you are old enough to have used a regular camera that you had to manually focus, I know I did for many years until I just switched over to using my iPhone. And the lens of a camera helps really sharpen an image. And you see the image on the left is fuzzy of the children. It's because the lens of the eye becomes more yellow, and it becomes cloudy, and it becomes thicker. And what happens with that is, because it's thicker, if you think of trying to stretch something that is thick, it's not going to elongate and shorten. So when we look at something close up, and I'm demonstrating with my hand here, our eyes come together and the muscles alongside the lens inside our eye shorten. They get closer together. But then when I look at something in distance, the muscles pull the lens out to the side. And so what happens is that the muscles can't fight this thicker and more yellow lens of the eye, so it has difficulty adjusting the size of it. So things become blurry. And initially with cataracts, things become blurrier at a distance as compared to close up. As the cataract gets more advanced, everything becomes fuzzy. People have difficulty seeing both at near and distance. So I'm going to pause for a second and just see if anybody has any questions about what is a cataract. And you can unmute or you can type them in the chat box. Anything in the chat box? Okay, that's just fine. I'm glad that this is making sense. So how does a cataract relate to a fall? Well, when the lens of our eye is getting more yellow and thicker, what happens, especially at distance, it creates a halo, and people become more sensitive to glare. So if someone with a cataract is walking outside on a sunny day, they may feel like they can't see anything, that the light is too much. Well, of course, if you can't see, if you feel like you're temporarily blinded, that puts you at risk for a fall. At nighttime, in particular, persons with cataracts are more bothered by the lights of oncoming cars. They may feel that they can't see clearly when they're driving, as well as when they're walking. So particularly when you cut out the outside light, not glare type of light, then persons who have cataracts will feel that they just can't see clearly, and they may fall. A particular place that cataracts are of concern is when persons are going to the bathroom at night. So they may not see a hazard like an animal, or they left a piece of clothing or something that's in the way of their path to the bathroom, because the images are very fuzzy and they need more light. So the good news is that persons in the United States overall have access to surgery to be able to remove a cataract and replace the lens. And my husband just went through this surgery, and most typically the cataract surgery is very quick. It's maybe about 13 to 18 minutes, and they'll mildly sedate someone. They'll use a laser to make a little incision. The laser, hot laser, will kind of zap the old lens of the eye, and they'll kind of suction that out. And then, similar to glasses lenses, they'll pop in the new lens. They'll double check the whether or not the person is seeing accurately, and then there's some minor restrictions after the surgery in terms of not doing overexertion, making sure to initially use an eye shield and doing some drops, etc. But we're fortunate here in the United States that Medicare will pay for cataract surgery. It doesn't pay for kind of fancy cataract surgery, but, meaning that if someone has astigmatism and other things, but most often it'll pay at least for the basic one. I'm thinking back to when my grandmother had cataract surgery, and that was so long ago that they didn't have lenses to put into people's eyes. And so they took out her old lens, and she just had these very, very thick glasses that she had to wear. I don't know if anybody else saw that with parents or anyone who was much older than you, but cataract surgery has come a long ways. And I'm curious, maybe just for if anybody on this call has had a cataract surgery. I can't hear you, Carolyn.
Yeah, two people said that they have. One said that in both eyes they had surgery.
And did the persons who had it, did you have a good outcome?
Yes, yes, very much. Yeah.
Great. So unfortunately, though, in other parts of the world, people don't necessarily have access to cataracts surgery. So it is a very prevalent disease in other parts of the world, because oftentimes people, especially in underdeveloped countries, do not have access to the surgery. And I've worked with persons who have macular degeneration, and we'll talk about that shortly, who were told by their eye physician that, well, you have cataracts, but we're not going to bother doing it due to macular degeneration. And of course, I'm not a physician, I'm an occupational therapist, but I always encourage people to go back and talk with someone, because if you just think of wearing dark sunglasses on your eyes, if you can just let in some more light, which is what, having the surgery is, then you can see better and also minimize your risk of falls. So I always ask people to get second opinions in terms of if they're told that they're not eligible for it, just to make sure. All right. So we're going to move on to the next eye condition that's associated with age, which is macular degeneration. So is macular degeneration a loss of vision due to problems in the periphery of the retina, due to problems in the center of the eye, in the back, loss of vision due to problems with the lens of the eye, or due to changes in the pupil? So the peripheral retina, center of the eye, lens of the eye, or the pupil? 1, 2, 3, or 4?
It's like we got couple 1 responses, 1, 2 response, 4, 2. So again, kind of a mixed bag.
Yeah. Again, I think it's important to understand. So it's actually, the answer is number 2, loss of vision due to problems in the center of the eye. So in the very back center of our eye, that's where we have the cells of our eye that contain the ability to process very detailed information, like information to read, information, being able to see, let's say if you're making a beaded necklace or you're putting a screw in a hole, the ability to see very tiny details of objects. And what happens with age, and there's some other conditions, is that those cells in the very center of the back of the eye start to deteriorate. And so ability to have fine detailed vision that we need for doing fine motor tests or reading very small print starts to go away. And we'll talk about what it is a little bit more in detail. But in terms of, I have to flip over. Okay, so in 2010, and we're waiting for more recent data, there were 2.1 million persons in the United States who had macular degeneration. By 2050, this number is expected to double to 5.44 million persons. But a key, even a more important statistic is that 14% of persons aged 80 and older can expect to have macular degeneration. So I'll say that one again. 14% of persons aged 80 and older can expect to develop macular degeneration. So what is macular degeneration? So I mentioned that the cells in the back and the middle of the eye start to deteriorate. And there's 2 types of macular degeneration. There's what's called the dry type, which is just a slow progression of loss of the center vision. And you'll see on the picture on the right that things in the middle are pretty fuzzy. And there's actually a child holding a ball, but the person with macular degeneration couldn't really see that child's face or someone's face. So you develop what we call central blind spots. And the central blind spots make it very difficult to see not only people, but also objects that are in the middle. And so another problem associated with macular degeneration is that things get very kind of fuzzy and darker. And so this is a picture of a recent, this is unfortunately what's happening with our California landscape lately with the fires. So things seem hazy and dim. So people can't see objects of low contrast very well. So you can guess in terms of falls that if you're missing things in the middle of your vision and your everything seems to be more hazy and you need a lot more light, that those factors would make it a greater risk for falls. And the second type of macular degeneration that I forgot to mention is one called a wet macular degeneration. And what that is, it's when you actually have bleeding in the center of your eye. The blood vessels under those cells in the back of your eye, they start to bleed, and anytime you have bleeding within your eye, it's a more serious consequence. And so people have to go in and have immediate surgery, and then they have to have follow-up injections to make sure that the bleeding is stopped. So most people have the slowly progressive type that's called the dry, but some people have what's called wet, which is when it's bleeding. And unfortunately, there's not treatment for macular degeneration to ever reverse the vision to normal. So it's a matter of compensating and preventing it from getting worse. There are some treatments. For example, at certain points in time, you can take certain vitamins that will mildly slow down the rate of progression, but nothing reverses it. And for the people with the kind of macular degeneration where it's bleeding, it's a matter of controlling that bleeding by having these steroid injections inside your eye. So I should go back for a second. Was there any questions on macular degeneration? No? Okay, then we'll, well, I thought I saw something flash there.
Somebody said cause.
Oh, thank you. So they think heredity is probably the primary cause of it. In particular, persons of Eastern European heritage, Caucasian, are at highest risk for developing macular degeneration. Also, people with excessive exposure to sunlight, smoking, diet that's not a well-balanced diet, you know, a diet higher in fat and cholesterol. But the primary factor seems to be heredity. So if your, you know, grandparent had macular degeneration, then you might be at greater risk. Okay, moving on to diabetic retinopathy. Audience participation, again, I keep asking you to do this. So diabetic retinopathy is a loss of vision that somehow my typing didn't work there. So basically, is it problems with your central vision, peripheral vision, or peripheral and central vision? So we'll not include number 1. Is it number 2, loss of central vision, 3, loss of peripheral vision, or 4, loss of peripheral and central? So 2, 3, or 4.
Seeing some 4s, a 3.
Okay, thanks for participating. So it's actually a loss of peripheral and central vision. So if we think of the diseases we've talked about so far, the cataract affects the lens of the eye, macular degeneration affects the center part of our eye. In diabetic retinopathy, you can have problems all throughout the eye. You can have those central blind spots. You can have blind spots in your periphery. And it's actually a really significant eye disease. So let's delve into that a little bit more. So on the picture on the left, you can see all of these little white spots. And that's showing areas of scar tissue, and or over on the side, there's some extra bleeding. And that's what causes these blind spots, is that when people's blood sugar levels aren't controlled, then they start to get these tiny leaks or tiny bleeds within their eye, and it can occur anywhere. And what happens after time is that those little tiny bleeding areas will develop into scar tissue, which is shown by the yellow. And the picture on the right shows that the child, when you're looking at the child, you've got some loss of vision kind of on the side as well as in the middle. And if I'm from the Midwest, if you haven't guessed already, not from California. And in the Midwest in particular, we have huge cracks in our pavement, because you'll get the very hot weather and then you'll get really cold weather, you know. And what happens is that the cement can't adjust to the changing heat to it, and so it starts to crack. Well, in essence, that's what's happening with diabetic retinopathy. If someone's blood sugar levels are really high, then they're really low, and so the blood vessels within the retina of the eye start to deteriorate. All right, were there any, whoop, did I miss over something? I feel like, oh, I guess, okay. So any questions on what is diabetic retinopathy before we go on? Nope, okay. Moving on to glaucoma, which is another age-related eye disease. And the incidence of glaucoma, like all the rest of these eye diseases, is increasing, and is expected to be 5 million, let's see, by 2050, 5.3 million. All right. So audience participation, again, I keep asking you to do this, but is glaucoma loss of your center vision, your peripheral, both center and peripheral, or the lens of the eye? So is it 1, 2, 3, or 4?
It's like we got 2, 1, 4, 3. Whoa.
Okay, that's all right. That's the whole purpose of this, is to explain it a little bit. So glaucoma is a loss of our peripheral vision. So what are we seeing out to the side? And what happens in glaucoma is there's actually many different types of glaucoma. Some can be clogged tear ducts on the side of our eye. That's the most common one. Something closes over the ability to drain the fluid within our eye. And if you think of it like a balloon, then the inside of our eye is increasing in size because of the extra fluid inside. And then we have a nerve that comes out the back of our eye. It's called the optic nerve. And what happens, if you picture, is that this increased size within our eye starts putting pressure on that nerve, and then we start to lose our peripheral vision. And they call glaucoma the silent thief, because people can still see well in front of them, which is what the picture on the left side is showing. They're not always aware that they're not seeing objects out to their side. And so the difficulty with that is that people may not be aware of persons or objects coming not only to their side, but above them and below them, because they're still seeing well in front of them. And there's a greater tendency, glaucoma is not just an age-related disease. Persons who are Black or of Latino heritage also have a greater incidence of glaucoma. And let's see, let me flip here. So in terms of fall risk, I just mentioned that if you're not seeing things kind of all around the outside, you may miss things that could hurt you. You might walk into a tree branch or a sign overhead, or you may not see something that's out to your side, and so then you may trip over it, or you may be startled. So the most common accidents are tripping and bumping. And to manage glaucoma, most often it can be managed by using eye drops on a regular basis. There's different kinds of eye drops. Some are steroids, and what they do is they lessen the production of this extra fluid. Sometimes there's more, they want to create more eye drops. And in severe cases of glaucoma, when someone might have intense sudden pressure, they'll actually go in surgery and open up these eye ducts. So like any other eye disease, if somebody were to have sudden changes in their vision, then that's a medical emergency and they need to see an eye doctor. Another common age-related change is a decrease in the size of the pupil. And the pupil is what lets in all the light. It's in the center, the black area here. And so if you can picture that the size of our pupil is getting smaller. I've seen some older adults who actually, the size of their pupil is like a little pinprick. Well, with so much less light coming in, then they're going to be missing objects that are of low contrast, and in particular have problems at nighttime. So people will need extra light to be able to see. And especially if walking outside, their fall risk will increase, or going to the bathroom at night. And the last normal age-related visual change that occurs is difficulty adjusting to changing light levels. And some of you may actually experience, just looking at this picture, where like, oh, that hurts my eyes looking at that bright sunlight coming through the tunnel. And what happens is this process of difficulty adjusting to changing light levels actually starts when we're in our 40s and continues throughout becoming older. And it's difficult for persons to walk from a dark area to a light area, or vice versa. They're outside and then they walk into a dark building. And what happens is that persons may stop suddenly because they feel temporarily blinded. And if they stop suddenly, somebody may bump into them, or they may not see a threshold of walking over into a different light level. And the last age-related eye condition is dry eyes. And dry eyes can feel very scratchy, and there's less lubricating fluid that's being produced, and other symptoms might be stinging or burning of the eyes. And this normally was just an age-related condition, but with our excessive dependency right now due to COVID on using the computer, actually younger persons are developing dry eyes as well because of looking at the computer screen. And usually over-the-counter eye drops will help with dry eyes, but sometimes someone may need a prescription eye drop. And unless the dry eye becomes very severe, it can cause fuzziness of vision. Normally, I would say that this doesn't correlate as highly with a fall risk. So at this point, you may be asking yourself, I don't know what I can do to prevent a fall as I age. I have some of these problems, or I'm worried about getting them, and I'm not sure what I can do. So the first intervention that you probably want to think about is light. And this is where, when I worked with my clients with low vision, I would always start with light. Adding more direct light, overhead light, and automatic light. So we're going to go into these in more detail. So direct lighting is usually thought of as task lighting. And Task lighting is when you can focus a light within 8 inches of what you're looking at. One of the best types of direct task lighting is a flexible gooseneck type desk lamp, because you can adjust it low. And to produce the least amount of glare, when you adjust a light low, it should be lower than your shoulder height. So the light should be placed lower than your shoulder. You can use direct lighting for close and distance with a flashlight. And there's many flashlights now that are very tiny. You can put them in your pocket. You can put them in a purse. You can take them places where you're trying to see something close up as well as in front of you. But direct lighting in a variety of on your desk and perhaps your kitchen and other places can really enhance the contrast of what you're looking at. Oftentimes in working with older adults in their home, I found that many older adults have very dim overhead lighting. They may only have table lamps, or they may have overhead lamps with old incandescent bulbs, or they don't have enough of both of these, or they don't have many built-in, what we call canned lighting. And I think that many persons as they age don't realize, due to all these just age-related eye conditions, that we need 3 times as much light when we're age 60 as we did when we're 20 years of age. And I remember growing up, my parents would go, "How can you see in that dim light? Turn up the lights." And we're like, as a child, I said, "Of course I can see," because you've got a healthy retina, you have a healthy lens of your eye, and your pupil is the right size, and so you're letting in a lot of light. But so if somebody age 60 needs 3 times as much light, well, somebody age 80 is going to need 4 times as much light. And if you're going to minimize the risk of a fall, you really need to increase the amount of overhead lighting. And sometimes that can be done with using brighter bulbs, not old incandescent ones, but ones that are found more. In fact, the other day I looked at Home Depot for incandescent bulbs, and I couldn't even find any at Home Depot. So if you have incandescent bulbs, you may consider getting rid of them, but you may look around your environment and really see, could I install more lights so that when I walk into a room, it's much brighter? So food for thought. So focused light beams, if you have a pet, you certainly can use a flashlight if you're walking your pet in the dusk or the evening. Another place, if we are able at some point to go into movie theaters and plays, I know those are some of my favorite things. Using a flashlight to walk into a dim setting is very, very helpful. So remember to bring along a little flashlight in multiple places with you, especially when it's dusk and nighttime. There's a variety of ways to use automatic lights now. My husband is good with technology, so he uses a phone app called Wink, and it automatically turns on lights in our home at various places at sunset, and then it turns the lights off, usually at 11 p.m. There's the old-fashioned light timers. There's some nice, I just ordered these for my mother who's almost 91. There's some plug-in motion sensor lights that are great to put into hallways. And if you walk by them, they'll turn on. And one of the things, because we have problems adjusting to changing light levels, is if you can light up pathways, so hallways, so that you're not going from a dark room to a light room. You can also have a motion sensor, so when you walk into a room, that it'll come on. So there's a variety of different types of automatic lights, but consider using those to help illuminate the passageways from one room to another. And Okay. And let's see, where am I on my thing? The next way of compensating for low vision is considering the use of contrast and color. So the colors that we can see easiest are black and white, which are shown on the right side here, but then also our eyes can see easiest bright fluorescent. So oftentimes we use duct tape to label something, or we might, to put on the edge of a stair, we might use a piece of tape so that we don't trip and fall over that. And the colors that are easiest for our eyes to see are really bright pink, fluorescent orange, and bright yellow. We don't see red very clearly. Red actually is not a good way to enhance contrast. So contrast can be a really effective way of changing our environment and using black on white or what some of these bright fluorescent colors. And you can apply that to many things within your home. So in your bathroom, if you have a white tile floor, consider getting a dark colored throw rug that has a good rubber backing. Or in your kitchen, you can use high contrast. So if you can't have difficulty seeing the edge of a stair or a change in surface levels, you can put a bright contrast strip of duct tape, or maybe more of an edging that is painted in a contrasting color. So there's many, many different ways you can use contrast. But that's the second most effective way, lighting, then contrast. Another important concept is managing glare. And all of us need to wear sunglasses. We need to minimize our exposure to the UV lights. However, sometimes people choose the wrong sunglasses. They think the darker the better. And if you think back to all the eye conditions we talked about, all the eye conditions cause us to need more light in our environment. And if you use too dark of sunglasses, then you are actually increasing your fall risk because you're cutting out the contrast that you need. So oftentimes I would work with clients and we would try different colored sunglasses which are available, and we try them both inside and outside and see which one works best. I actually found that for my low vision clients that a gray color or kind of a medium shade green seem to be the best colors for people for blocking out glare but not changing the contrast so much. So make sure you're not using too dark of sunglasses. And the other kind of sunglasses you may want to consider are wraparound sunglasses. So it blocks off light from the side and above, because if you're sensitive to glare, if you just use the regular sunglasses or clip-on ones, you're still going to have light coming in from the side and above. Another very, very key important factor for you is to go for regular eye visits. We all need to prevent eye conditions from developing or manage them. And some of the eye conditions that we talked about, like the diabetic retinopathy and the macular degeneration and glaucoma, people need to go more frequently, between 3 and 6 months. If you just are going for regular eye checks, usually every year is fine. Don't postpone your cataract surgery until your vision is very impaired, because that puts you at greater risk for falls. And as I mentioned earlier, any sudden change in your vision is an emergency and you should go and see an eye care specialist. And I couldn't help but put this in because I, after being an occupational therapist for 4 years and focusing on vision and falls, is that I believe that occupational therapists are a really good resource for you to help you look at your home environment and help you find ways to compensate for any visual deficit. And our American Occupational Therapy Association defines occupational therapists as persons who help older adults to safely do the things they want to do. They, meaning OTs, work with people in their homes, their workplaces, their communities, or facilities. And we do have a lot of training in home modifications, fall prevention, and low vision. So you may consider asking for a referral to an occupational therapist. So in summary, low vision is due to multiple age-related eye conditions. It's really important that people medically manage their eye conditions. Vision loss does contribute to a fall risk, so it does contribute to falls. For preventing a fall, the best methods are to increase your light through direct lighting, task lighting like with the flashlight, and increasing overhead light, reducing glare sensitivity, and using contrast. And consider obtaining a referral to see an occupational therapist. So I wanted to say thank you for participating in today's seminar and to open it up now for questions.
All right, thank you so much, Beth. So we're gonna have a couple minutes here for questions. Feel free to type those into the chat box, and I'll just go ahead and read them as they come in. So somebody asked floaters to retinal separation versus detachment. I'm assuming he's asking, is there a difference between those two?
So floaters are actually when the fluid within, it's called vitreous gel, within the eye hardens in places. And unfortunately, there's nothing you can do for floaters. They just, as they sound, they float around your eye and intermittently block your vision, and then they move over to a different part. The retinal detachment is when actually a part of the retina inside your globe pulls away, and that's a medical emergency. So if something like that were to develop, you'd have a really severe sudden loss of vision, and you need to see an eye doctor immediately. So floaters are very different. Floaters are chronic, and unfortunately, nothing you can do. Retinal detachment, they would do surgery and repair it. Other questions?
Yeah, someone else asked, can you get cataract surgery prematurely, too soon?
No, but your insurance may not pay for it. So, you know, should you wait until your vision is 2100 or whatever? I don't think so, because I think that makes you at great risk for falls. But do you have to wait until your insurer pays for it? I mean, unless you want to pay out of pocket, yes.
Okay, someone else asked, how does high blood pressure affect vision?
Good question. If you have uncontrolled high blood pressure, you can have some of those same little like tiny bleeding which occurs in the eye. So similar to diabetic retinopathy. So it is an important factor to control, not only for vision, but so many other complications due to chronic high blood pressure.
Okay, someone else said they have bad vision in one eye and have trouble discerning cement curve changes. So do you have any suggestions for this person?
Yeah, so we've got some great resources here in the San Diego area. There's the Braille Institute, there's a San Diego, there's another Low Vision Institute, and I would encourage you to go there. There, you might consider using, if you can't tell curb heights, I know nobody likes to do this, but sighted canes are a good way of detecting changes in surface levels, and there are mobility specialists who can train you in the use of a sighted cane. And I mentioned before, occupational therapists who specialize in low vision, they might be able to problem solve with you how to use your remaining vision best.
Great. So one other question here is macular degeneration detected during routine eye exams? And as a follow-up question, what is the term for crystals that form in the eye?
So during a normal eye exam, but you need to have the eye, your eye dilated so that they can see the macula or the center of your eye. The crystals, I believe, is what someone else referred to as floaters, because there aren't really crystals within our eye, but that's probably, again, the gel that lubricates the inside of our eye hardens, and so it moves around our eye. I think crystals probably mean the same thing as floaters.
All right. So we'll give it a second or two, see if any more questions come in.
I did put some resources in my PowerPoint, and I don't know, will PowerPoints be also posted on the San Diego Fall Prevention Task Force website?
So when we upload the video, all of this will appear. Haven't decided yet if we'll post the actual PowerPoints,
Okay.
but
I can stop sharing.
So I think there's one more question we'll try to squeeze in because we have 5 minutes here. This will be our last question. So blue light function on cell phones at night, is that something that you recommend?
No, for two reasons. One is that they found blue light, especially at night, makes it difficult for us to get into a good sleep preparation. So I think from a sleep perspective, no. I haven't been able to convince my husband on that one, but and there's a lot of evidence that's growing about this constant use of the computer and cell phones, and how it might be really helpful to use reading glasses that have a blue light blocker in them. But I don't think I answered that question fully. So can you repeat it again?
Yeah, blue light function on cell phones at night, is that something you recommend?
I guess I answered that then.
Yeah, I was gonna say, perfect. Okay, one more question squeezed came in. Does LASIK affect cataract surgery?
No, because LASIK is in the cornea of the eye, and they're tiny little slits all, and it's the outside of our eye. The cataract surgery is in the lens, and that's interior in the eye. So they're kind of two separate things.
All right, perfect. So thank you everyone so much for attending today's session, and thank you so much to Beth as well. She took some really complex topics and was really able to simplify them for us, so thank you. If you have any other questions, we encourage you to email our email address. I'll go ahead and type it in the chat before we close. And also, if you haven't registered for some of the other workshops that are coming up today and also tomorrow, I encourage you to do so. I'll also drop the link for that registration as well. So thank you so much, everyone, and have a great rest of your day.
Thank you for participating.